Hello, my name is Elaine Edwards, and I'm a BSN student at Aspen University. This PowerPoint video is a video about the path to certification for nephrology nursing, and that is nurses who provide dialysis to patients in the hospital on outpatient setting, among other things. The objectives of this video will describe what types of certification, who's eligible to receive, how to obtain the certification, relevant study materials, and most importantly, why is it important that nurses obtain certification? This slide discusses the reason why nurses become certified. One reason is to advance education and earning power, recognizes an individual's expertise in the specialty, such as nephrology nursing, which is discussed here, demonstrates advanced knowledge and experience, and personal preference or goal. This slide here describes empowerment. In an article written in 2009 by Charlene Wade for the American Operating Room Nurse Association Journal, titled Perceived Effects of Specialty Nurse Certification, a literary review, it describes empowerment. And empowerment was the second most common reward of certification indicated in the study that she did. Empowerment refers to nurses' perception of extrinsic rewards of certification and achievement and success, such as higher salaries and professional advancement. It also includes their perceptions of formal and informal power on the nursing unit and participation in decision making. It also describes control over nursing practice, leadership within the healthcare facility, recognition of their expertise by other healthcare team members. This article here was written by Phillips in 2005. This particular article brings about the position statement of the American Board of Nurse Specialties that describes what nursing certification really is and what their vision and their mission is. It's called Promoting Excellence in Nursing Certification. And it is the position that registered nurses should seek certification in their specialty practice area, and that they should promote their certification by displaying their credentials and introducing themselves as a certified nurse to patients. Healthcare consumers should be knowledgeable of the qualifications and credentials of the registered nurse caring for them. And employers should seek certified nurses for their workforce, support these individuals seeking to maintain certification, inform patients and the public about the certification status of their workforce, and encourage the display of the certification credentials on identification badges, and market the accomplishments of certified nurses. Specialty nurse certification is an objective measure of knowledge which validates that a nurse is qualified to provide specialized nursing care. This slide shows more information about perception of certification. It's written by Williams and Garbin. And in the table, it talks about validating specialized knowledge. And that was a high number for nephrology nurses at 98.7% and technicians at 92.9%. Enhances professional credibility, also rated high for nurses at 96.7%. And then there was enhances the feeling of personal accomplishment. 98.8% of nephrology nurses and 90% of the dialysis technician report this. And still provides personal satisfaction. Your personal goals, 98.3% for nurses. And provides evidence of accountability, again at the bottom there, 90.1%. So you can see that having the nursing certification, you can develop your own positive self-concept, self-esteem, and self-efficacy. This slide here shows the type of certification that's available for nephrology nurses. And we can start with the certification for nurse practitioners. And it's a certification especially for them as long as they have been practicing at least 2,000 hours in nephrology. The middle one there, CNN, is a certified nephrology nurse. That can be obtained by bachelor's prepared nurses with at least 3,000 hours of experience in multiple areas of nephrology, such as outpatient clinics, transplant, hospital nursing, home therapies, and the like. The last one, the certified dialysis nurse, is for an associate degree nurse with at least 2,000 hours of nephrology nursing experience. And this information in detail can be obtained from the National Nephrology Nurse Certification website, the www.nncc-exam.org/certification. This is just more information that we spoke about earlier, and it talks about the different areas of nursing and nephrology nursing that nurses can do: home therapies, inpatient acute kidney injury or renal replacement therapy in a hospital, inpatient critical care on kidney replacement therapy, chronic kidney disease management not on kidney replacement therapy, kidney transplant, and apheresis, which is a type of, they include this in nephrology nursing. Apheresis is really therapeutic plasma exchanges that's given for multiple myeloma and different coagulopathies. And apheresis is a field that does red cell exchanges, white blood cell reductions in certain leukemic conditions, and like I said, therapeutic plasma exchanges. The CDN is the dialysis nurse. As I said before, 2,000 hours of experience will get you here. This is probably the least challenging of all the certification tests for nurses to pass. And the nurse practitioner is the most challenging. Of course, you have to be a nurse practitioner for 2 years and have 2,000 hours, plus 60 continuing education hour credits. And these credits have to be approved by the American Nurse Credentialing Center, ANCC. The American Association of Critical Care Nurses can provide these hours, the American Association of Nurse Practitioners, the Council of Continuing Education, as well as others. There's also a small certification test that nurses can take to become certified peritoneal dialysis nurses. And peritoneal dialysis is where the patient, pretty much this is home therapy, is the patient fills himself and are trained by nurses to fill themselves with the dialysate fluid as pictured here on the right in the abdomen, and that fluid dwells inside the abdomen performing dialysis for the amount of hours that the doctor prescribes, and then they would connect themselves sterilely to a drainage bag and measure all the effluent, we call it, that comes out, and then anything over the amount that goes in is what they would record as urine or outputs. This information here was taken from an article written in 2009 by Ferdon titled Nursing Perceptions of Specialty Certifications. And what it does is describe what it means to be certified, and it's basically verified. You are verified competent in your field and indicates a level of clinical competence, attainment of a practice standard, professional credibility is enhanced, promotes recognition from your peers and employers, increases consumer confidence, enhances the feeling of personal accomplishment, provides personal satisfaction and personal challenge, enhances professional autonomy and professional growth. And these are all the things that can be positive towards clinical decision making that we are required to do on a daily basis. And this slide here, it just shows a nurse, a CNN nurse, so she must be a BSN, that, as she states, it validates my personal expertise. And another nurse here, Maggie, she's also has her certified nephrology nursing, and it keeps me in touch with new trends and issues so I can better serve my patients. I encourage every professional nephrology nurse to get certified. Cherie Mullen, having my certification as a certified nephrology nurse highly magnifies my knowledge and experience. And that just goes back to the article's information that was talked about previously about personal goals. Ethics of caring. Being certified says to my patients and colleagues that I'm vested in my patients, our program, and the staff that I help train and mentor. As a nurse, I'm ethically committed to keeping myself educated and informed as I provide care to renal patients. This slide shows barriers. The biggest obstacles in our lives are the barriers our mind creates. Barriers. This talks about the barriers to becoming certified, and cost is right up there because these certifications are extremely expensive. The financial burden associated with certification certainly is probably the number one reason nurses haven't achieved it. The preparatory material serves as a significant obstacle for it. Recognition proved to be a significant barrier. And the e-learning system, the concept of downloading and uploading information that can get you your certification, may be difficult for older nurses who are not technologically savvy. And this information came from Dugan 2018 when they talked about addressing barriers to nurse certification through a structured certification achievement program. This is a very good article, and this is where this information comes from. This slide here just talks about more of the barriers in detail. The examination cost right up there, 73.7%. That's a high number because of the cost. And institutional rewards is another number that's high, 44.7. And lack of support, which should not be happening. Maintaining the cost of it, lack of access to prepared courses or material, discomfort with test-taking processes, lack of access to continuing education. And all this equals no desire, really. You know, and when people think, well, it costs too much and I don't get support from the institution that I work for, there's no reward, that makes individual have no desire. And then there's the other ones, the trouble with time fitting it into regular work, didn't know how to start the process, didn't have enough information about certification, didn't have time to prepare for it, and not sure of how to prepare, really. So all these things add up and will cause a barrier to obtaining your certification. But we want to turn this impossible into a possible. So breaking down the barriers, that's what we'll be discussing next. Breaking down the barriers requires institutional support. Senior leadership can initiate the certification process by identifying to staff the certifications they plan to complete. And this was written in an article by Zavernick. It had no date on it, but it's titled Increasing Specialty Nursing Certification in the Ambulatory Care Services. And this is some of the things that they talked about as far as leadership: providing support to staff prior to the exam, celebrating the achievement of those who pass, create an implementation plan for increasing certification rates across your nursing unit. And this does take leadership with vision, values that will empower the staff and encourage the staff to seek certification. This is information also from the same article, Increasing Specialty Nursing Certifications in the Ambulatory Care. And these were some of the things that they discussed, because learning is fun. Develop a certified nurse study course and create local study groups to promote team engagement. Recruit 2 to 3 staff members to serve as certification leaders. And dispel the myth of insufficient time by providing time. And some of the things you can do would be listed on future slides. This slide here shows ways to increase motivation. This is from Nursing Perceptions of Specialty Certifications, written by Ferdon in 2009. And it talks about motivational incentives that hospitals and leaders can promote. Increasing the salary of certified nurses, reimburse the exam fees, reimburse recertification fees. And some places do reimburse the exam fees, but I don't think they do the reimburse of the recertification fees. And this can be pretty hefty. The educational fees for the CEUs can be paid for. They can provide advancement for those who do achieve their certification, have paid time off for the exam and education, recognize the individuals as an expert by putting it on your name tag, promotion of it, one-time bonuses. All these things can be done to increase the motivation of staff nurses to obtain this type of nursing excellence. And remember, you've got the power. We just have to go out there and get it. And last but not least, every accomplishment starts with the decision to try. Again, thank you for viewing my video. I hope you enjoyed it.